Good evening, everyone. Welcome to Straight Talk for tonight's online community forum. This is going to be so informative, I promise you. My name is Pamela Duncan, and I am the president and CEO of Metropolitan Development Council. I am joined tonight by my dear colleague, Amanda Westbrook, who serves as the host for our conversations. Amanda.
Thank you, Pam. Well, tonight's conversation, if you can believe it or not, is the 32nd. That's right, the 32nd in a series of discussions started last year. We hold weekly discussions around important topics impacting our communities in Tacoma and Pierce County. Tonight, we return to talk about the topic that launched Straight Talk, to invite a panel of experts to discuss what is happening with COVID-19 in our state, region, and community.
And the most important message throughout the series of conversations is that there is hope for our community.
We would like to take a moment to acknowledge that this meeting is being conducted on Indigenous lands of the Puyallup people. We gratefully acknowledge that we rest on the traditional lands of the Puyallup people, where they make their home and speak the Lushootseed language. Throughout tonight's conversation, you can submit your questions to be answered by our speakers using the question and answer function in Zoom. We cannot promise that we'll have time to answer every question, but we will make our best effort to get through them in the allotted time. Before we get started, we would like to take a moment tonight to acknowledge what happened in Tacoma over the weekend, when a Tacoma police officer drove his vehicle into a crowd of people in downtown Tacoma Saturday night, injuring at least 2 people. We recognize that the tensions are high, and we hope for healing, we hope for peace, and accountability for what happened. Now I would like to introduce our guests for tonight's discussion, including our dear friend, Dr. David Hirschberg from RAIN Incubator, joining us for the 4th time on Straight Talk. Dr. Hirschberg, yes, a round of applause. There we go. Dr. Hirschberg has also invited 2 of his colleagues in the medical field to join us for tonight's discussion. Please join me in welcoming Kelly Gutierrez, who is a pediatric nurse with MultiCare Health System. Welcome, Kelly, and thank you for being here. And also joining us is Dr. Blair Irwin, who is a medical director with MultiCare Health System. Welcome, Dr. Irwin.
Thanks.
All right, so this is how we work this discussion. To get started tonight, we like to check in with you and to see how you are feeling. And when I ask how you are feeling, what I'm really asking is, how's your heart doing? How are you today during this pandemic? And in the spirit of moderating, as Pam has taught me, I let the silences spiritually speak for themselves. So I will not call on names. I'm going to let you jump in as you see fit throughout the rest of our conversation. So, how is everyone feeling?
So I can talk. Can you hear me?
Yep.
So I would say I feel hopeful, but at the same time frustrated. I think we've got some great vaccines at our fingertips. The science that has occurred has just been revolutionary, and these are really effective vaccines and can protect people from this virus. What I'm frustrated about is the distribution. I saw 25 patients today in clinic, and they all should be getting the vaccine, and it's weeks to months away, and they all ask me each time, when can I get my vaccine? And the fact is, I don't know. I wish it was available to give give to my patients and broadly now.
Thank you, Dr. Irwin. Thank you for that.
I think those are the best ways to describe it, is hopeful, but also frustrated. It's for people in the medical field, it's pretty easy to get a vaccine. You sign up and you get it. But for people in the community, people are struggling, and like family members like my dad have been struggling to get his, and it's just frustrating because it's so easy for some and so difficult for others.
Thank you, Kelly.
Yes, I would jump in too. I mean, I've been fielding a lot of questions, and of course, as a scientist, I can kind of talk about, I can almost escape to the comfort of the science and the facts. I'm also involved in a lot of community testing. And so I see people today, you know, who are sick and afraid that not just they have something, they have a respiratory infection, and you know, the best I can do at RAIN right now is to tell them it's not COVID. But, you know, there's other things out there, and obviously combinations of stuff. And, you know, to me, the ability to get answers is uneven right now in a community. And so, you know, hopeful still that, you know, we know the science is there, the technology is there. I'm hoping that, you know, events like this will really basically illuminate the disparity in healthcare, and hopefully we as a community, we can really start working on this, not just vaccination, but just treatment, staging, all the care that leads up to it. So I have mixed emotions. It's events like these that just give me a second to stop and kind of think about these kind of things and what we could possibly do.
Pam, I'm going to call you out for a second because I know that both you and I have elderly, you have an elderly mother, I have an elderly mother-in-law. My mother-in-law is not scheduled. She's 82 and has rheumatoid arthritis and can't get her shot until the middle of March. So I know that you also take care of your mother. How are you checking in today with this?
I agree with everything that I've already heard, the frustration, and, you know, with everything that is now happening yet again in our communities, and I am hopeful. And at the end of the day, I will always hold out hope. I go by the mantra, where there is life, there is hope. So we're in a tough place right now, and I am very hopeful with what we are hearing from the new administration and what the goals are, that we will get through this. And just as you mentioned, Amanda, my mom won't be able to get her vaccine until the end of March. And I consider at least she's scheduled, because that's so difficult. And it took me logging in early in the morning. And that seemed to be the golden ticket, just logging in super early. And there were some appointments that are available. So I'm hopeful for us as a community. And we already know, you know, this just took too long.
It did. So, question for all of you. It's hard to believe that it's almost been a year since the first cases of COVID-19 appeared in Washington. What are your thoughts about what we have learned and what we still need to improve upon 1 year into this pandemic?
So we've learned sort of better how this virus is transmitted, and the differences that personal protective equipment can make in protecting all of us from getting this virus, and they can make a big difference. we've developed some therapies. We've gained knowledge about how to best manage these patients, both in the outpatient setting and in the hospital. That can make a real difference and even, flip the coin from not surviving to surviving. But the mortality rate is still way too high. So we've got a lot more to learn about how we can treat this virus. We also need to learn about whether these vaccines will provide long-term immunity. I mean, they were developed so quickly, we don't know that. I suspect will be protected to some extent, but we may need a booster at some point. So sort of the long-term data on these vaccines is still pending. That doesn't mean that I wouldn't endorse getting it. It's clear that they provide protection, but we don't know what the long-term effects are. I think to David's point, learning how it's really highlighted the disparities in our healthcare system, the effects of this virus on different groups, it's just not fair. So that's one of the reasons I want to do events like this, to try and improve understanding of the need for personal protective equipment and vaccination, to try and even the playing field here.
From my standpoint too, just to add to that, it is remarkable that we have a vaccine within a year of really a sequence being published, really. That is a testament to what we can do. Would it have been better if we had only 1,000 people infected in the United States right now, rather than, or if we'd done the job that a lot of the other countries did, which was just basically following a playbook that was really developed starting in 1918, when a lot of mistakes were made, and we had this pandemic playbook. And I guess for me, the shock that our leadership didn't take recommendations of our public health officials to heart. In spite of that, I remain very optimistic. I'm pretty hopeful that this will never happen again. I'm worried we have a long trudge ahead, another couple months of really some serious pain, because a lot of our leadership just didn't act and really take the recommendations that were right there. We are playing out exactly the playbook. What I'm hoping now, though, is we do have a vaccine. Yes, there are some unknowns, but we also have a technology really where we're just editing instructions now, and in a matter of days. This vaccine was developed in 2 days after the sequence was published. 2 days. We've been going through the safety and the hesitations of distribution since then, but there's no reason why we couldn't literally have these in vending machines almost in a few days after any variant happens. And not only for this disease, but everyone that's going to come along in the future, and some of our existing ones. There's a lot of promise and excitement. And I'm hoping that's this education, as we get this out there, this is a chance at equity, is that if you can develop these vaccines cheaply and distribute them to everyone, not just in the United States, but everywhere in the world, there really is, hope that a lot of the diseases that we have that constantly plague us, other diseases like dengue, malaria, influenza, could be easily conquered. That's exciting. If any young people are out there and you're wondering about what career you would want to go into right now, to me, healthcare, medicine, science, in human healthcare, I can't imagine a better place to go. And right now, right at this beginning of this new opportunity we have.
Dr. Hirschberg, I love when you said this is our chance at equity, because equity has so many different definitions during a pandemic, a COVID-19 pandemic and a Black Lives Matter pandemic. And the two are intersected. I'm going to stay on this question for a second because, Kelly, it occurred to me that as a pediatric nurse, even though pediatrics by definition are children or up to maybe 16 or 18, I'm not quite sure the age, I'm sure you know that, you are still you're seeing whole families. You're seeing a parent bring a child in. So what is your point of view on this question of where we were almost a year ago and what have we learned during that time from your family point of view?
I think there's still a lot to learn from, especially from the beginning where a lot of people weren't taking it seriously, thinking it's just kind of like the flu. And even though pediatrics isn't necessarily getting hit as hard as the adult world, and children aren't seeing as severe as adults are, you still see families come in with parents, grandparents coming in positive, and that's how the children get positive. And pretty much that family dynamic of what do we do now with our kids? We're all positive for COVID. There's a lot into play with that, and a lot of disparity comes in. We see certain groups that are getting hit harder than others. And it's just a very weird time to be a healthcare provider during a pandemic where you are there to help everyone, and sometimes your community not necessarily is as hopeful or as grateful as you'd wish them to be. You hope that everyone wears a mask and quarantines and keeps their distance, but sometimes you don't see that, and it makes it feel kind of frustrating to kind of show up to work every day and knowing not everyone is following the rules to keep everyone safe. And that's our goal, is to keep everyone safe, not just one another or just your own group, to keep the whole community safe.
Kelly, that was so well said. I mean, I am so guilty of looking at neighbors or neighborhoods with families outside and going, where are your masks? Just being outraged, and yet understanding that sometimes families, just out of love and sheer desire to be together, they miss some vital protection issues that have been laid out since the beginning. Pam, is there anything you'd like to add to this? From your MDC point of view, what could we have done better a year ago?
So first of all, I'm going to say I don't consider that guilt that you are expressing, but vigilance. And I would say that from our observations, as an agency that has inpatient services, behavioral health inpatient services, I am extremely grateful that we have not had any type of outbreak, given the government's response, the federal government's response to this virus. That we've had certainly some cases, but nothing where to the extent that we've lost anyone, whether it was a patient or our staff. And I would attribute that to the clear guidelines that we received from our governor, and as well as our local health department, and everyone abiding by that. And so I'm very grateful.
Well said, Pam. My next question, and it also was brought up in the chat by one of our heroes of the Pierce County Council on Pierce County Council for Homeless Coalition. I think I said that wrong, but you know what I mean. Garrett Nyland, who we love this man so much, he brought up this question, and this is the question. Just yesterday in Pierce County, health officials announced the first case of the UK variant of COVID-19 was found in a Pierce County resident. What do you think the variant will mean for people in our community?
Okay, I'm going to hit it from science. So I feel more comfortable. You can tell me with the rest, but I mean, there's no evidence yet that the mutations are more virulent, or obviously there is some debate about whether it's spreading faster. The fact that we can map it, I worry. I mean, all viruses will change and mutate. That's what they do, and it's actually, this is the 7th coronavirus that has been transmitted to humans that we're tracking. And 25% of most of the winter diseases may be caused by other coronaviruses, alpha and beta coronaviruses that are circulating. And so at one time, they probably appeared in humans. They emerged from animals. It's likely bats. And they were virulent, and over time they try to adapt, and it's actually better for the virus, if you think of its survival, that it doesn't kill off its hosts, right? So what's concerning about this is it's so widespread that there's many chances for mutations to happen. And obviously the virus is very small. It has a few constraints, and if it mutates too far, it doesn't survive. But there's been surprises. So I can't say scientists won't be surprised again. It looks from what has happened so far, and remember, there's many different strains. So lots of mutations, RNA mutates. Strains are usually something we track as something that's significantly different. And many of these strains have appeared, and they're being tracked. But none of them, all of them look like they're covered by the existing vaccine framework, so to date. So there's no reason for any additional concern. I'm more worried about COVID-19 in general and how widespread it is, and how people aren't wearing masks and not doing social distancing and going to parties until we get this under control, than I am about mutations appearing. I do think we have the technology, we have the ability to change the vaccine if we need to. And it won't have to go through the strict safety profiles now, because this is really just adding a little bit of instruction to it, much the same way we do the flu vaccine, except only better. And so I don't think, from a scientist standpoint, I worry about mutations. What I do worry about is really how widespread it is, and what the chance of mutations happening, given we've let it expand so much in our population, and we have so few vaccines to give out. And we have also people who are reticent to taking the vaccines and bringing it under control.
So Dr. Hirschberg, just a point of clarification, and I want to make sure I heard you correctly. Is there a difference between a mutation and a strain?
So a virus has to mutate. RNA is inherently full of changes and errors. It's just not, it's why we use DNA as our templates, because RNA makes all kinds of mistakes when and this virus is a little bit sloppy. So there are always mutations in viruses, RNA viruses. A strain usually is something that's identifiable through, like if we sequence it, we can see it as a strain, and it can be a marker that has absolutely nothing to do with virulence or how infective it is. And so what we're always looking for is a way to identify it. If there is a case that it seems like there's a strain that is more infective, we want to find that marker so we can identify it and track it. So that's the difference in that. From our standpoint, we have a virus that has 26,000 nucleotides. It really only has a few genes, and it's very limited in what it can do. And if it changes too much, it stops being able to infect us. So really, that's kind of the way we look at it, from tracking it and being able to identify it, where it came from.
Thank you for that clarification, Dr. Hirschberg. So Dr. Irwin, you sit at this director big 30,000 level. What's this going to mean for our community?
The mutant version. So my understanding is that it perhaps is more infectious than the prior strains. So I think it just means we need to wear protection, just be really vigilant about our social distancing and protection. It's not fancy, but wearing a mask really does help. This is what I've done for so long. It's so hard on the psyche, all this social isolation, but it does protect us. I will say one of the interesting things is that our incidence of flu is way, way down. We are And it's because people are isolating and wearing protection. It's at like 20% of what it normally is annually, and maybe even lower. It's a hard road to hoe. We've had a little bit of decline in our hospitalizations in Pierce County because people are protecting themselves. So I'm wondering if, as this new strain spreads, whether it might climb again, whether our ICU rates and hospitalizations might climb again. What it means is we need to get that vaccine out there, and we need people to continue to wear their masks.
So Kelly, from your point of view, dealing with a whole family, what do you expect the response is going to be in this community?
Well, it's kind of something that Dr. Irwin said, is that we're seeing less of flu, and that's exactly what we're seeing in pediatrics, is that usually the winter time, it's our busiest season, and we are seeing an all-time low of numbers because they're not going back to school. We are, for the most part, doing some sort of social distancing. And I think all we can do really is continue that. There's nothing really fancy that we can make a community do. Like, this is the simplest thing we can do is social distance and continue to wear your masks and come to the hospital when needed. And again, hopefully everyone can get vaccinated as quick as possible.
So speaking of vaccinations, Pam had this great question, and the question was, how quickly does this vaccine become effective in humans? And then we're going to talk about those 65 or older having trouble getting vaccinated. So how quickly does the vaccine become effective in humans?
So I don't think we really know. This is all over the news. It probably provides some protection after just one, but the data, I'm a data-driven provider, and it's for 2 vaccines, and that's where you get the 95% efficacy. So I would be guessing. We didn't do trials. I think we're now looking at what the protection is after just 1 dose, but I don't know that.
Yeah. I mean, the estimates are, it's approximately 50% efficacy. That means, it's a 50-50 if you want to look at it that way. And then the second boost, and that usually is within 14 to 21 days. The second boost, either for Pfizer at 21 days and Moderna at 28 days. After 14 days after that, you get to that 95%. And that is for people with the perfect situation with the perfect immune system. In real life, that's why we talk about herd immunity. It's not everybody gets that exact that because of the differences in our immune systems, and just in our own individual makeup.
Pam, what would you like to add to that?
So, this is really good that we are having this conversation, and what it tells me is that as people are getting vaccinated, is that right?
Yep.
The healthcare officials should be encouraging people to continue to wear their masks. Just stay the course of the PPEs, and don't go out and think you can party the night you get it, or even 2 weeks after. Just continue to be cautious, because we know we are seeing folks who won't even wear their masks, wear a mask, making an assumption they have a mask, but they're not wearing a mask. And I can just envision a potential additional surge if people are thinking that now they are shielded by a bubble of protection.
Yep. And just to play with the numbers, 95%, you can flip that around and says that, 1 in 20 people who receive the vaccine may not be protected. And that's under perfect conditions. And if you're surrounded by a community that isn't vaccinated at all, it really can be much higher than that. So it's really important for us to really maintain all these things we've been doing. The simplest are, washing your hands, wearing a mask, staying socially distanced, making sure that if you're going to be in a situation where you're coming in contact with people, you have all these things in place, and making also decisions not to do this for social reasons or things that really could put a lot of other people at risk.
I want to throw out this question here, and when we talk about the efficacy of this, and Rob brought this up, and it's true. It's a perfect example. At least one congressional member who was in the Capitol during the January 6th resurrection got COVID, despite already have had her first shot. And then we also know that one of our own, Senator Jay Paul, also got COVID as she was huddling with some members of Congress who wouldn't put their mask on underneath that table in the room. So there are no guarantees, are there, in the sense of, as you said, Dr. Hirschberg, 2 days to get this vaccine up and going, and boom, it was out. So there wasn't a whole lot of time to do some checks and balances for the sake of getting it spread around to those who need it. Speaking of those who need it, I want to talk about some of the older residents. The way the vaccine is being rolled out right now, it's hard to understand. We opened the show with that. What do you think it's going to take to make getting a vaccine easier for people to navigate? And Kelly, I want to start with you, because you see families, you see herds of people that come in that maybe have several members of their extended family that have COVID. Maybe some refuse to wear masks. Maybe some are going to be that phrase we've heard, vaccine hesitant. What is it going to take?
Wow, that's a very complicated question. I honestly don't know. I know that it's very, like I said, it's been, for me to get my vaccine, it was very simple. I logged onto my chart, boom, there was like a million dates. But for other people, it's like in the community, it's so difficult. You have to find if you're eligible, and then you have to go into all these clinics and see if there's appointments, and then you get an appointment, and then sometimes it's canceled because they don't have enough vaccines, or you try to call and you're on hold forever. And it's discouraging and frustrating. Like I said, my dad was trying to get his vaccine and I was trying to help him. I was on hold with 3 different clinics for probably 40 minutes each and could not reach one person to talk to them if they had vaccines available. And he even had one appointment, and when he showed up, they said there weren't any vaccines left. And I can't imagine people, I mean, that's my dad with having me who's in healthcare. I can't imagine someone who's not good with computers, who's not good with technology, who doesn't have that social support to tell them where all these resources are. It's hard to see where these resources can come from and how do we support people, but I just know that there needs to be support for these people.
Well, and as Dr. Hirschberg said, that great quote, this is going to be a t-shirt, the chance of equity. There are so many barriers sometimes to our older people and to BIPOC of actually getting online. I mean, we all don't have great daughters like Pam that get up at the crack of dawn and on our hold waiting for someone to pick up. So yeah, I mean, it's difficult. Wouldn't you agree, Dr. Irwin?
Yeah, Multicare has tried really hard. For example, I know our experience here to accommodate these appointments, but so, we had our call centers handling these calls, because you're right, a lot of people don't want to go into my chart and book appointments that way. That's the simplest way to do it. You try and call, the call center is just not equipped to take the volume of calls. They're getting 2,000, 3,000 calls into a center that's got staffing for about 400 calls a day. So, I mean, we just aren't prepared to handle this volume. So you're going to wait if you call. And it shows the terrible inequity. If you're not savvy with the internet or don't have access, it's a barrier to getting the vaccine.
Is there anything you'd like to add to this, Dr. Hirschberg or Pam?
I would. This isn't isolated. What we are hearing from our healthcare professionals here on this call isn't isolated to our region or our state. I have been also trying to assist my aunt who lives in a different state with getting an appointment for the vaccine. And what you just heard is the same situation. There are no vaccines available. It's interesting. There's a lot of navigating through websites to get to a list of who might have them, and then you call, no one answers, or everybody's out of the vaccine. Everybody has a waiting list that's hundreds of people long, and this is where we are.
Yeah, I think you've said that beautifully. I want to answer a question that was put forth in our Q&A, and I want to open it up to all of you here. And the question came from one of our viewers, and this is the question. Since she's already had 2 family members and who have died from COVID, and I am so sorry, my heart goes out to you. Does that mean that she is more likely to die if she catches COVID? Doctors?
I would say not necessarily. And I'm hoping Dr. Irwin will clarify that. But, you know, it really depends on what dosage of the virus you get and when you got it. So, you know, we've gotten much better at medical care and saving people since March. We've learned a lot. We have better ways to deal with large numbers of sick people. We have better PPE. We have more treatments. And of course, now we have vaccines coming. And then of course, so it really depends how we did it. The other thing is nobody can really predict how we're going to do. You just don't know what combination of events can help you live or die through this. Also, many people have been in households where many members died and they lived, and they're actually protected in a sense. You know, they have antibodies. So a lot of things. So clearly not. I mean, that is, you know, it's. I don't think that is something I would worry about. I'd be much more worried about is being socially distanced, wearing a mask, you know, and doing everything I could to minimize either me being infected or me transmitting it to somebody else.
And Dr. Hirschberg, just for the sake of efficacy and transparency, I should correct it. She had 5 or 6 members die of COVID in her family. I just want to make sure that we have all the facts out when I ask you the question here.
Yes, certainly being around a lot of sick people. I mean, we had first, you know, people on the front line, like first responders, doctors, nurses, overwhelmed by the disease. When you're surrounded by sick people, that's why we were talking about flattening the curve and really getting those initial, you know, if you're constantly around people who have high titers of virus, you are likely to be overcome even if you're healthy. And so getting those, you know, the numbers of sick people down, flattening that curve is really critical for being able to survive as a person in that, but also for healthcare workers that are surrounded by people who are sick.
I want to switch over to vaccinations here. There's so much talk about vaccinations and the safety of them and the availability of them. Can we talk a little bit about the current availability from Pfizer and Moderna?
So I think you're talking about availability. So what I know for the state is, I take that. So my understanding, we're getting about 100,000 vaccines a week, but our need is actually about 3 million people within Washington state if we're just reaching patients who are over 65 or people who are over 65. So that's why we're struggling to get people vaccinated. quickly because we're not getting enough vaccine every week. And the other thing that's affecting this distribution and affecting a health system's ability to plan and staff appropriately to schedule is that you don't find out how much vaccine you're going to get until, that week, right? So you can't staff up. And that's why you lead to these issues with patients showing up and there being no vaccine left. But that despite that, there are things that health systems are doing, like we're doing, where if you really use the vial well, so if you use a syringe that really preserves every drop, you can actually get an extra dose out of the same vial. So usually it's 4, but you can get to 5. So at the end of a work shift, we'll often have some doses left, and we have sort of a same day list where we'll distribute this little residual left. So that's not true across the country. There are some health systems that are still trying to figure out, and they're actually tragically wasting this extra dose because they don't know who's not going to show up that day. They don't know. They haven't set up the infrastructure to do this callback system at the end of the day. And if you don't have it's a fragile vaccine. So if you don't use it that day, then it's not going to be effective later on. So you have to use it or lose it, I guess. I think that's what you were asking.
I was, and as all good questions and great answers, they lead to another question. And I don't want you to be rushed if that could happen virtually. But what I heard you saying was those great smart doses you can get out of some syringes go onto a same day list where you occasionally can call people and say, hey, we have X amount of doses. Would you like to come in and get one? Did I hear that correctly?
That's right. There's some residual doses left at the end of the day. We have a triaging system for how we handle those, but it just takes a lot of infrastructure to make sure that you preserve every drop.
And so I'm sitting here imagining for all, maybe not for you, Dr. Hirschberg, because I don't sense that you are interfacing so much with patients as you are with colleagues and scientists, but also you do interface with other doctors. But for you, Dr. Irwin, and for Nurse Kelly, so here you have these people ready to come in. You find out there's no vaccine that day. You call them up and say, I'm sorry, but your appointment's been canceled. And so here you have some credibility issue and a don't shoot the messenger issue on the phone, or the receptionist does. Then you call them back and say, hey, guess what? We have a little bit of dose left. How difficult is that in an already difficult situation?
So I've actually worked many shifts actually at the vaccine clinic for multi-care. And exactly what Dr. Irwin said is we have certain syringes especially for Pfizer, that we could get. I think it's actually 5 to 6 doses that you can get from them, and 10 doses in the Moderna vials. And sometimes there's people who don't show up. So you have these extra doses, and we've gotten better on how to distribute them. At the beginning, we did have some extra ones and we were scrambling to find out what to do with them. And now we have this like on-call list of people we can call and say, hey, we have an extra dose of Pfizer or Moderna, and depending whether it's their first or second dose, kind of figuring out how to distribute them that way.
It's really tricky though, because if we allocate it to someone on this list, then we've got to make sure they've got a second dose, right? Mm-hmm. 3 to 4 weeks later. So the tracking of this becomes really complicated also.
Yeah, but was telling some of my coworkers that vaccine math is very stressful. So I've done a few shifts where we close and you have to count how many people are left, how many vaccines you have. Do you need to open another vial? And it gets stressful because you don't want to waste any doses. You want to be able to give as many as possible without kind of compromising or having the potential to throw some away.
Kelly, I'm having one of those moments in 8th grade when I wished I would have listened to you've got 2 trains going this way, and I'm going, no, I'll never have to use that math. Think again.
Right.
So I want to talk about vaccine hesitancy. And boy, that's a phrase that our new administration just slid right in there, and it's a good one. So there are people who are deciding not to get vaccinated or saying they want to wait and see. How should we communicate with those people who are on the fence about getting a vaccine? And Dr. Irwin, I want to start with you first on this one.
This is a hard one.
Yeah.
I believe in self-determination, and nothing is more personal than your own healthcare. So, I think it's everyone's right to refuse the vaccine. I hope that the hesitancy isn't because there's a concern about the efficacy of the vaccine. I think we've got really good data that shows efficacy, and I think that if people had been seeing the number of deaths that sort of firsthand, I've spent a lot of time this past year managing patients with COVID, and it's a terrible illness. And you hear about families like this color where so many people have died. I mean, this can prevent that. So I would encourage everyone to get vaccinated, but do I think it should be mandatory? No. And but it's tricky. Within a health system, it's not mandatory right now, and not everyone is getting vaccinated. We're thinking about whether to do that in the future, but that's not the case. It is a requirement of employment that people get the flu vaccine. You can say a personal exemption. I imagine that in the future that we will move towards that. I wish everyone wanted to get vaccinated. That's my wish for our community for the future, but I don't think it should be forced.
Warmly and humanly said.
Mm-hmm.
Dr. Hirschberg, I want some science point of view on this.
Well, I actually agree with Blair that nobody should be forced to be vaccinated. I think where I'm having trouble is really, I feel and I appreciate having forums like this, we haven't done a great job in educating everyone, because I do see disparity, differences in people. I look at my staff here at RAIN. We do science, we have all this, we have immunology, we've taught people. But I've noticed really people of color in my organization are afraid of vaccines. They and justifiably they see there's a lot of distrust with the medical system. I mean, going back to Tuskegee experiments to even modern day, the way a Black person maybe, or a person of color is perceived when they go into a doctor's office, and that we have these kind of institutional things where people are treated in various different ways, and there's a fear of vaccines. There's conspiracy theories. People are worried about sterility. These are conversations I have, trying to do this. My effort to be part of these forums and to really educate people is really to where I feel equity, what equity is really being able to bring people to the needle. And then all I say is once that needle goes into your arm, it doesn't matter who you are. But to get people to the table, I was talking to Kelly earlier in the week, and when you have those extra vaccines, how hard is it, or how easy is it to get it in certain people's arms? It's very easy. White people are going to be most likely wanting to take that, and people of color, there's some hesitancy, there's some distrust. And so figuring out how to overcome that, educate people, I think really Department of Health, a lot of agencies, I asked Pam, take a picture of yourself when you get your vaccine and tweet it out as a leader, because that's what, you can hear me say it as a white male, but when I see leaders, people of color, heads of organizations, showing themselves getting vaccinated, that's really what overcomes a lot of this just inherent fear.
So Pam, you are a Black, beautiful woman. You are a leader in our community. You also are the CEO and the president of MDC. So What are your thoughts on vaccination hesitancy?
I'm going to say, first of all, I can completely understand why there is the hesitancy because of how BIPOC communities have been treated in our time in this country by the medical profession. And those big major gaffes have left residual feelings and lots of distrust. So I am first going to acknowledge that. And I am part of that community. I am also, as the CEO of an organization that has inpatient services, the health department granted MDC, acknowledged that MDC staff should receive vaccines. And as Dr. Hirschberg mentioned, he encouraged me to take a photo as I was receiving the vaccine and post it. What I didn't share with him is that I am so very private and I typically don't post things. I did have a photo taken. I will let folks know that the vaccine was doggone near painless. Receiving the vaccine was I didn't even realize that the needle and the vaccine itself were going into my arm. I did feel a little soreness in the injection site the day after, and I have been closely monitoring myself since then. It's been a little over a week, and I would just let people know that I don't think I'm an outlier, that I feel fine, and I'm very grateful that we had the opportunity to receive the vaccine, and that I can say to the community that I would encourage people, unless they have some medical issues that their doctor says you just can't get it, to please get it.
Kelly, I want to bring you in on this because I can see a scenario where you have a mom and children sitting down and they're like, I'm not going to get the vaccine. I'm too young and I'm too busy. So what do you say to them?
Oh gosh, I think there's a lot of talk of the anti-vaxxers, and that's a whole discussion in itself. But from my own experience getting the vaccine and I've given hundreds of vaccines, the COVID vaccines, and people are just very excited. There's lots of people who are nervous and have anxiety about it, but I think their anxiety of getting COVID outweighs their anxiety of any sort of side effects that the vaccine may give them. And I think I'm in that same page. I mean, it was developed early and everything, but I mean, I'd rather have this protecting me instead of potentially getting COVID and seeing what results from that, or surviving and knowing what morbidity I could get from it.
Okay, so Kelly and Dr. Irwin and Dr. Hirschberg, get out your crystal ball, because you're going to need it to answer this next question. Do you believe that enough people will get vaccinated in our community so we can begin to return to something normal later on in the year? And Kelly, we'll start with you.
I'd like to be optimistic and say that enough of us will get the vaccine. I think maybe after seeing, again, community leaders and friends and family who've gotten it, people will feel more comfortable following suit and getting the vaccine themselves. Like Pam said, I only had a sore arm after my second dose, or first and second dose. I didn't get any major side effects. But I mean, I'm surrounded with people who get COVID, and I'm surrounded by a medical community that was very eager to get the vaccine. So it was easy for me to decide that, yes, I wanted the vaccine. People are in very different situations than I am.
Dr. Hirschberg, what do you think about that?
Well, like I said, I am optimistic. I do think we are going to ramp up. We have a new government and not to politicize this, but organization counts. And, I think our community has done an amazing job in the last year, but the cavalry needs to come. And these public health has to be a little bit top down. You need to get vaccines. We know scientifically you can generate this vaccine in 2 days. We know we can get through safety data and generate good data that makes it actionable. We know we can produce this at these companies. There are 40 RNA vaccines against COVID going through safety trials now from different companies. So it's not just going to be Pfizer or Moderna, but you need to mobilize a company that does logistics to get the vaccines to people like Dr. Irwin and Dr. Goody and Kelly, Nurse Kelly, because we need to get these into people. And it needs to be done equitably. This vaccines do not work if they're only given to wealthy people who live in 6,000 square foot houses. You need to get them to everybody. And that's what's going to bring our society back to normal. That it will happen. I can just cite that if you look in Israel, which purchased a lot of vaccines, Pfizer's actually collecting data on them, and they've way ahead of us in terms of per capita. I think they have over 25% of the population vaccinated, and they are going to tell you when herd immunity happens, whether it's 60%, 70%. It is a number up there, maybe 80%. But we are going to have that data. And the United States is distributing a lot of vaccines. We're at 1.3 million a day. I don't know specifically for this area what our numbers are. But when you think about that, we have to distribute over 660 million vaccinations if you vaccinate each person twice. And at 1.3 million a day, that's a couple years. And so we need to ramp this, and it needs to go up easily tenfold and more. We have currently, what I saw, if you go to our data in, I'll give you the link to the site, but it's our, I can't remember the name of the site, but it's off the Hopkins site. It's about 20 million people have been vaccinated so far in the United States. I think over 60 million vaccinations in the world. We have a long way to go, and we need to accelerate this. Our World in Data, that's the website which tracks vaccinations.
So, Dr. Hirschberg, one of the questions that came up while you were talking about this was, are we working on a cure for this? And I know that's a big question at 6 o'clock in the evening, but I'm glad it was asked. So there it is. Are there any rumblings about if this equals this, there could be a cure?
Boy, I mean, there are a lot of treatments. I think vaccination is wonderful because it basically stops. I was told by a CEO of a hospital that said the best thing you can do is keep people from coming to the hospital in the first place. And so, to me, vaccination, clean drinking water, good health care, equity in, our society, if you want to have your population healthy, because the weakest people in our population undermine us all. And so for me, all these things we do to build community is really, and vaccination is part of that, clean drinking water, all these things, nutrition, healthcare, these are all things that make us healthy as a community, and that really keeps everyone healthy. And so to me, I do think we'll learn about these, we'll have treatments, but vaccines are wonderful in the fact that they just prevent the problem from occurring in the first place.
So one of my last questions here is, we would be remiss if we didn't talk about the shift in the presidential administration. And, as Dr. Hirschberg said, he doesn't want to get political, but as I often say, but politics is about morals, values, justice, and spirituality. So let's get political, because we need to be. It saves lives. And that's just my opinion, not the opinion of MDC. So what does that mean moving forward in our fight against this pandemic, Dr. Irwin? This new administration, what does it mean?
So I think there's a movement to organize, as Dr. Hirschberg said, so really establish a plan for vaccine distribution and manufacturing. I think there's also a plan to provide PPE, the appropriate PPE. And we haven't talked about this, but there's variation there. You probably heard locally, there's been a lot of complaints about lack of access to PPE, including N95 masks. I hesitate to say that because probably folks on this call saw the New York Times article over the weekend about, how to stop this pandemic, is to give everyone an N95 mask. It's a very, very tall order. We have shortages even amongst our healthcare workers. So I don't want to promote everyone wearing an N95 mask, but it would protect us from getting getting this virus and others. So speaking of politically charged, so I should say I don't speak for Multicare, I speak for myself. But I think investment in public health has been lacking over the last several years, and a belief in the benefits of public health. So I'm hoping that this change in administration puts that at the forefront of our legislative policies.
Kelly, our wonderful host, Rob, over here, sent me a great message just now saying, 50 state plans versus just one being ours. We have this new administration. We finally have a plan. And it looks like some kind of logistics plan. What are you hoping to see?
I think just with a new administration is that shift from going from an administration that undermines like science and undermines health officials and going to one that essentially believes in it, I think will be will make a huge difference in kind of our communities and society as a whole, just more trust instead of more undermining that was previously seen.
I agree. Last question for all of you before we say goodnight here. Are there any more critical nuggets of information about COVID-19 that we should talk about before we say goodbye? Dr. Hirschberg?
Well, again, thinking about infrastructure, I'm eager to get past COVID-19 and make this back in our rearview mirror. But this virus was not something we planned for, and the fact that when I did tabletop exercises with my colleagues, we were always thinking of something worse than COVID, something that would be more infective or something that would be more lethal. And kind of a relatively minor respiratory infection that we should have been able to control with just the standard PPE that we have, and just listening to basically doing the many of the techniques that we had in 1918 that developed from there. We should have been able to defeat this. And because of really just a lack of or individuals feeling that their individual liberties might have overcome what the public health system and safety for the rest of us dictated. And I'm worried that we're very vulnerable for what's coming next. Pandemics come often, whether they're affecting animals, agriculture, or people. And we probably are going to have something new in 3 years, and maybe as much as every 3 years. And of course, with global climate change and health disparity, we really are set up to not be very prepared for this. And what I'm hoping we can get from this is realizing that the pain that we had when you compare with the response from other countries was really just a lack of leadership, a good, clear leadership. And I'm hoping that we take some lessons from this, and this prepares us for what will come next. And that as a society, we really have to work together. It isn't a Democratic problem or a Republican problem. These are human beings, and it doesn't matter who you are. This virus really doesn't discriminate once you get rid of all these other disparities that we are imposed on people. So what has gotten us, what has done so much damage to us, our economy, our jobs, our people, has been our inability to really build a strong, equitable system that really is protecting all of us.
Nurse Kelly, what is your golden nugget for us before we say goodnight?
I think don't just think about yourself, but think about others. Wearing your mask is not just for you, it's for your community, it's for your friends, your family, for the strangers that you walk past. And I think that's just one thing that we don't take into consideration when we wear a mask, is that it's not just for you, it's just for everybody.
Beautifully said. And Dr. Irwin, what's your
I'm going to just shift a little bit and just plead with folks to donate blood. Actually, there's a big shortage of blood in our community, and for people who've had COVID, we're collecting their plasma, and it can treat patients now. With this COVID pandemic, people have been afraid to go to donation centers, and we haven't been able to do blood drives because of social distancing and that sort of thing. But we, our BloodWorks Northwest is holding and safely collecting blood from people in our community, and it's a really direct way that you can help people who are suffering from COVID.
Absolutely, and I've had several of them on my show, and the protocols are so tight and so well done. And giving blood in the Boeing Museum and looking up at those airplanes, that's a win-win in the military brats book. So go give blood, but get your appointment.
Yeah.
Okay, I want to say thank you to all three of you for being our frontline heroes tonight. And I'm going to turn it over to our beloved Pam to drive us home and tuck us in, Pam Duncan.
Amanda, thank you so much for your moderating of this conversation tonight. Actually, you weren't a moderator, you were the facilitator of the conversation. Thank you so much. And I want to say thank you as well to our guests. Thank you for taking the time out of days that I'm sure frequently seem endless. So we just want you to know how much we appreciate you. A couple of things. As a board member of the Red Cross, I will echo what we already heard about being a blood donor, and that on February 22nd, the Red Cross will be holding a blood drive at New Community Church in Tacoma. And wherever you see, whenever you can give blood, please do so. That's so critical, as you've already heard. And that MDC is also working with the Red Cross to see how we can host those sites as well. And then just in closing, I want to elevate that what we are faced with is also a culture shift. If you would consider what we've seen in many Asian countries, you see people for years have been walking down the streets with masks on, and that's commonplace for them. And Americans have just thought that is just the oddest thing in the world. And when we first began even talking about masks, people, that was just completely out of the question. People could not even envision walking down the street with a mask on and how that would be taken. And now it's slowly becoming a little more commonplace, but for some folks and some communities, when there's resistance to it, we don't see that happen. So it's a continual and ongoing encouragement for people to wear those masks. So that's a cultural thing as a Western community that we have to become completely acclimated to for the duration of this pandemic. So that was my little nugget for you, Amanda. And again, I want to say thank you for everyone who participated in this conversation tonight. Thank you for those of you who were able to join us, whether you were on the Zoom call or we also did a live Facebook stream. So there are many other folks who were able to listen in as well. This conversation has been recorded. So we always post those a few days afterwards on MDC's website. Thank you again, everyone. And we just wish you all the best in health and take good care of yourselves. Bye-bye.